Hi everyone, good evening. Dr. Sanjeev here, and we'll be talking about back pain. I'm just gonna wait for everyone to come in. Hi, hi Dr. Raki. Hi everyone. Hi everyone. Hi
Hello.
Jason and John. Thank you for
Hello,
coming.
doctor.
Hi, good
Yes,
evening. Yep.
you first.
Are you okay?
Yes, we're good. Can you hear me, doctor?
Hi, you can hear
I'm
me?
good.
So we're
Yeah.
gonna start in about 5 minutes. We're gonna let everyone come in and join in. Yeah.
Okay, sure.
So guys, welcome to rumpelsurgery.com Instagram Live. And today we have two of my good colleagues, physiotherapist John and Jason, and they're from Apple Physiotherapy. And we're just going to wait for everyone to join, and we'll start talking a little bit about back pain.
All right, great. Is our voice clear here, doctor?
Yeah,
Are you
it's good.
hearing us good? Yeah, okay.
So just for everyone's information, the physiotherapist in front of you is Jason. I've known him for
Hi,
about a
everyone.
few years now, and he's a very knowledgeable colleague of mine. And same, and the other colleague of mine is John, and they are both from Apple Physiotherapy PJ. So we're gonna wait for maybe another 3 minutes. Okay,
All right.
yeah. So maybe you guys wanna maintain SOP. Maybe John can leave the room and one guy one side, or just separate, so it'll be a little better.
Yeah, later, because John is quite a distance away, later we will switch over when it's time
Okay,
to
excellent.
give the talk out. Yeah?
Okay. Or what you can do is yeah. So we
Okay.
just a little bit, a few more people to join in, and we're gonna start our session. Hi, Atika.
Oh, yeah, the comment there.
Hmm.
Hello.
Okay. Let's see whether I can do this. Yep. Okay, we're gonna start then. So welcome everyone to rampasurgery.com Instagram. And basically today we'll be talking a little bit more about the common back pain, which is the most common orthopedic related problem among normal adults all around the world and also in Malaysia. So we'll be talking a little bit more in detail about not so much orthopedic wise, but basically a simple summary about what you can do if you do have back pain, and what is the role of physiotherapists, and what can they help, and maybe they will go through a little bit about low back care advice. That means what you can do at home to prevent the back pain from getting worse. And I'm joined today by I'm Dr. Sanjeev Rampal, and I'm joined with two physiotherapists bit for a long time now. One of them is Jason, who's in the screen, and also John, and they're from Apple Physiotherapy and Rehab here in PJ. Yeah. So basically, we'll start a little bit about back pain. So back pain is, as I said before, the most common complaint in the musculoskeletal region, or basically when it comes to dealing with pain over the body. Is the number one complaint that is the most common, and 5% of people once in their life will see a doctor or their primary or their general practitioner, or what they call a clinic doctor, once in their lifetime for back pain. So back pain is huge. It's a huge part of our practice. Causes a lot of disability and is very costly. So today we'll talk a little bit more about what is the different types and how common it is. As it is most common, and it's usually in the lower back, where the area of your belt, or if a person would wear a belt in the belt area or the lower back, and if it's more common among the ages of 30 to 50 years old, and it's not all back pain would be considered as slip disc, but we have to see what kind of pains are there. You have to describe the pain as when pain is either localized in the central part, also on the outer part of the lower back, and also whether the pain goes down to your buttocks or down to your limbs, your legs, or whether there's weakness and there is numbness over the legs that would warrant something that it needs to be seen. So usually when I see patients like this, I would it's a multi team effort, and I have two of my good colleagues over here, physiotherapists, trained physiotherapists practice, and maybe we'll go through a little bit with them, because I want their perspective about, because it's not all about the doctor, it's about a team effort. It's about basically treatment, medicines, and also physical therapy also a lot. And that's where we have Jason today. And today, maybe Jason, you can introduce yourself a little bit. And yeah, you can just introduce yourself a little bit, and then we'll talk to John after.
Okay.
Yeah, go ahead.
Do allow me to take off my mask, yeah, doctor? Okay, so I think it's clearer. People can hear me better now. Okay,
Yeah.
First of all, thank you, doctor, for having us today. So my name is Jason. I'm a physiotherapist working for Apple Physio. So today my colleague and I will be giving a talk on some simple back care, mainly on the physiotherapy management side. Okay, so it's a very common thing when we come to low back pain. People come to us, they will say they have difficulty doing certain movements. They have experience of that numbness, that pain down the buttock. Maybe some of them even have that numbness going through lower than the calf area, some down to the feet. Okay, so as common as we see these, so how we usually manage this, we categorize them into two types. Most often they enter physio clinic as outpatient. They would have two situations. Situation one is that they have already seen the doctor. So they come to us, maybe a doctor would have written a referral letter for physiotherapies as such. So this patient is having so and so this condition on low back pain. Okay, so most of the time, if there is a referral letter, that would be good. We would mostly manage on how do you say, their pain, their symptoms.
Yep.
We would also teach them how to take care of their posture, because there are multiple reasons.
That's exactly what it is. So can you go through us, what would you do to talk to them about their posture? Like exactly what would you recommend them? Okay.
Now, for the posture part, I will give that to John, because he will be presenting many of that. So what I want to emphasize is we say that the pain, the low back pain, is not only caused by structural damage. Okay, there are also other associated factors, such as the posture, the stress over time. Now we know that a lot of people are working from home. They will be working heavily with their laptops, the phone. So all this posture gives a, how do you say, a cumulative strain to that muscle. Given some of them, they do not sit on a proper desk environment. They would be sitting near their coffee table, the floor, the sofa, and moving around from place to place. Yeah,
Yeah.
so that is one thing we should take note on. And then we also want to check whether they have any other activities they have been doing, because now the MCO timing, a lot of them couldn't go out for exercise. So some
Yeah.
of our clients still come in with a new onset of back pain. So as we investigate further on their recent activities, they might be, how do you say, involved in a new exercise routine, some
Yeah.
yoga classes they saw on YouTube. They might be
So
doing it a little bit intensively.
that's very true, Jason. So let's just say a patient, the most common patient would be back pain, lower back, and then pain coming down buttocks and legs. So how would you go about treating this patient, and just like maybe make it more simple language, so you don't just describe the things that you would do at your center.
Okay, so we focus here on the management of back pain. Mainly is to, first, we have to reduce that sensitivity to manage with that pain they're having. Whether or not we can do some modalities like putting on some TENS, hot pack, cold pack, and whether some ultrasound is needed. That is number one. Then second method we will emphasize on is the use of manual therapy, where
Okay.
certain muscles we can help to stretch them out, loosen it up. Yeah, for the joints which are stiff, we have to mobilize it to make it easy for the movement. Oftentimes, this would help with that radiating pain and all the pain down the legs and all.
Excellent.
Mm-hmm.
So
Yes.
the trans-electrical neurosurgeon or anything like that, or no?
Yes, we do that if that's necessary for the case.
Yeah. So what is that? Because for the people's benefit.
Okay, usually that TENS, short form TENS, is a stimulation to the nerve. Basically, what they do is that that device gives out impulse to that nerve so that it kind of distract the brain away from the pain. Yeah, so they benefit with a reduced sensitivity, less pain on the
So
structure.
Jason, can you describe to us like what the actual home remedies? Now, let's say one of the patients, they have pain with the back. They haven't seen a doctor yet, but what would
Mhm.
you recommend them do, like home exercises or stretches that will kind of prevent it from getting worse? Yeah.
Prevent it from getting
Yeah.
worse.
Can you describe the actual exercises that you would recommend your patients to do at home first?
Okay. Okay, Ken, for this segment, I will pass it to my colleague John because he
Yeah.
has prepared some exercises to be sharing with
Okay.
the
That,
audience. Yeah.
yeah. That's
Okay, just one moment. We'll switch over.
yeah.
Yeah.
Hi.
Hello, doctor.
Hi,
Yeah,
John.
allow me to take off my mask.
Yeah. Good evening, John.
Yeah, good evening, Dr. Sanjeev.
Yeah, John is one of my other colleagues. So, John, maybe you can describe a little bit about yourself and your experience, and also talk a little bit about home exercises for back pain. Yeah.
Yeah, okay. So, hi everyone, I'm John from Apple Physio. I've been being a physiotherapist about 2 years. Yeah, so I've been in the center in the hospital setting. Yeah, both I have experience in that also. So yeah, from Dr. Sanjeev, what we're going to talk about today will be some exercises which involve stretching exercises and also strengthening exercises. So people will always come to us that think that physiotherapist kind of exercises is more in specific and then it will be very advanced. But actually, for our exercises, it's actually quite simple. And then, so today, I will start with stretches exercises, and the exercises will be more in lying position, so where everyone can actually do it. And also, if you have more severe kind of back pain, sometimes people couldn't walk too much, and they will be spend most of their time in lying position. So these exercises is suitable for them also.
Okay.
So the first exercises we'll be talking about will be cat and cable exercises. So I will be showing you on the screen. So it will be something like this. Okay, so from here you can see that the person is doing in a kneeling four-point kneeling position. So the first and the second will be like suck in your stomach and rounded your shoulder. Okay, and the one that below will be like arch your back. So this one will be calling as cat and camel exercises. So this is a very simple kind of movement of your back involving your upper trunk and also your lower trunk. Yeah, sometimes when someone have lower back pain, so they'll be quite difficult to do this movement. And then I will show you another more simple exercises. Okay, so this one is one of the simple one, which is called knee to chest exercise. So just bring your knee close to your stomach and then hold there maybe for about 10 seconds. So people usually find this movement is quite comfortable. And
yeah, that's simple too, I guess.
Yes.
Yeah?
And then
quite simple.
Another one will be in extend position, because what you want to understand is when our trunk go to extension kind of movement, it will actually reduce the pressure over our back. So
Okay.
This one is a movement. You'll be showing the video type. Yeah, so this movement is just to extend our trunk and push our body upwards. Yeah, it's a very simple yet effective kind of exercises that everyone can do at home.
That's just fantastic. Yeah. So the three exercises here, you were saying? What was the three exercises?
So this is the three kind of stretching and mobility exercises.
Okay. And what about muscle, passive range of motion and movement of the back? Do you have any of those?
So now we're going to the strengthening and also improve the muscular structures of the back. So as we say it back, we can say it as a core muscle. So when we see the back, we have to see it as a whole kind of muscle. So when it involves our spinal muscle. So the first exercises we'll be talking about is the pelvic bridging. So it will be something like this. So just lift our buttock up, and then we can squeeze our buttock muscle. So this movement is better when we hold for about 10 seconds. So this one will actually help us to strengthen our lower back muscle. Okay. So the next one will be a bit more advanced, but I'm sure everyone with higher pain tolerance, they can do that also. This one is more in advanced in training the whole back muscle. All right. This one is called Superman exercises. So basically, you just lying down, and then you lift your hand and leg up together. Yeah, but if you find it difficult to do, you can also lift up your upper body first. Maybe you can rest for your lower body. All right.
Okay.
So this one is a strengthening exercises.
Yeah.
And then another one which is more convenient to most people, because this one they can do even in sitting or in standing. Because sometimes when people having this kind of irritating pain, it's during their work. So during your work, you can do this kind of exercises. This one we call trunk extension. So it will be something like this. All right. So you're just standing, and then both hands on your pelvis, and then you just move back. Okay. Just move back. Okay. This one is more effective when you repeat this movement about 10 times. Okay. So this one is a very convenient, which people can do it anywhere they want. So even in sitting right now, I can also try to extend my back and come back. So it's a very simple kind of exercises, and then everyone can do.
Basically, is not bending forward, but trying to maintain a straight back or hyper extension of the back, right?
Yes. So the movement is more into hyper extension of the back.
Fantastic. Okay, thanks so much. Do you have any other tips for the guys out there?
Yeah, so now I would like to share about some postural care.
Personally tried a few of those. The Superman one was really hard to do because it needs a strong core muscles, and that is usually another region where you need to work on it, on your core muscles, of your abdomen and around there. Is
Yeah.
yeah, you were saying, yeah. What was the last one you wanted to ask?
Yeah, just to add on the point, because
Yeah.
mainly what physiotherapy was doing is to try to promote people to move more. So when you move more, it tends to reduce the pain in a psychological way also. Mm. So
Okay.
now we talk about the postural care. So
Oh,
there's people
excellent.
saying this sentence where the best posture is the next posture.
Yeah.
So
So
one
wait.
one of the important point here, yeah.
So basically, so for our audience, right? So people who have back pain, so we usually pain that unresolving, that is typically centrally, and if you have numbness associated with it, or numbness pain coming down your buttocks, legs, is something that you need to investigate. John over there was nice enough to tell us a few remedies where you can go home and to strengthen your lower back, and this helps with prevention of and stretching, dealing with back pain. So now we're gonna talk a little bit about back care advice. It's more about prevention of back pain. Yeah. So how do we prevent already sore back? So how do we prevent it? And John is going to give us some tips about how to prevent this problem from becoming a bigger problem, and also how to strengthen your low back. It all comes with posture. It all comes with experience of trying to correct yourself. Even me, I slouch a little bit, and that causes a lot of problems. So he's going to go through us about what low care back care advice. Yeah. So even the patients who do have a slip disc, not all of them need to go for surgery. So they need to maintain a low back care advice. And that's what John is going to be talking about a little bit now. Yeah, John, go ahead.
So when we talk about posture, right? People usually they will get started, the pain started when they sit for too long or stand for too long. So what we would advise is every 30 minutes, then you can try to move a bit. Maybe you can stand up, go to take a sip of water, and then, or you can go to a restroom and come back. So just try to move about every 20 to 30 minutes, if possible. All right. So this one, you can add on with the exercises within the walk, go to come and back, and then you can doing the trunk extension exercise. If you're able to do that, you will definitely feel much better for your back. Okay.
Yep.
And then the second one is have to avoid slouching. So when we say the word avoid, it's very hard for most of people to do this one, because one of the reasons is
the same thing, because
yeah.
If you are slightly taller or you're slightly more leaner, you actually hunch forward and stuff, and that's
Correct.
mine too. Yeah. So go ahead, tell us how do you prevent
So
that.
when people don't have the awareness of that, they will start slouching their body. So when we're having a back pain, so we have to install our mind that, okay, we're having a back pain, so we have to take care of it most of the time. So what we can do is just always stretch or bring your chest forward and up, and then you can sit more straightened. But the same thing happens, usually, even though you are sitting upright, very upright, the pain usually will come also. So from time to time, you can slouch back, and then you can come back to the straight position. So you can switch between these two also is a possible way also. All right. And then another thing is when we are carrying heavy things, as we say always, use our leg and not our back to carry things. And then another point that is important is when you carry heavy things, try to take the things is closer to your body. So we try not to take too far away. And
so John,
John,
this is so important because so many of them will come with like this. Because
yes.
even if you carry something more than 2.5 kilos at a distance, hands breath away from you, that can even cause a prolapse disc. So
Yes.
do tell them a little bit more about this.
So when we are carrying further away the object, it tends to increase much more pressure over our back. So what we advise is closer to your body, even though it's very light. For example, our handbag or something, we go to the shopping mall when we carry things, the grocery. Try everything close to our own body. Try not to take it further away. All right. So next we'll be talking about the back care habits. So one of the most important habits that we need to take up is have an active lifestyle. Okay. And then actually recent studies show that the athlete, our spine, they have a disc, right? And then most in the athletes, their disc is actually more thickened, and the inside the fluid is much more nutritious compared to our average people. So what we can say here is when we are more active, involved in like sports, running, lifting weights, it actually helps in our back to provide a more stronger back.
Excellent.
Yes, and then another thing is, as we said just now, always remind ourselves to lift, have a correct lifting techniques. All right, and then another is you will always heard people say maybe their sleeping posture is wrong. Actually this one, regarding this one, actually the sleeping posture doesn't correlate much to the back pain. So what we need to take care of instead of sleeping posture is your quality of your sleep. And then another thing is your stress level. So these two actually correlates much more compared to sleeping posture. All right. So maybe like for example, you can sleep about 7 to 8 hours a day, and then bring your stress level, find out the stress factor which cause you to having more stress, and dealing with these two is actually helping you in terms of low back pain also.
Excellent.
Yeah. So this one is the back
John,
habits.
would you like to tell us about how to sleep actually? Because these patients, when they sleep is very important, and or what kind of positions, or do you recommend anything for the lower back to sleep in, for them to
previously I have got one patient also. He's complaining of always having back pain. So we've been treating about 1 to 2 sessions, and we couldn't really find a better way to improve his symptom also. Then finally we find that when he was sleeping, she's sleeping in a face down position. And actually this position is not really ideal in treating when you're having back pain. So what we will recommend is when you're sleeping facing upright, your tummy facing up. And another thing is maybe you can underneath your knee, you can put a pillow which bends slightly your knees. So this one actually straighten our spine, which it will reduce the pressure and also reduce the sensitivity of the pain. Yeah, so this is what I would advise. And then for the pillow also, maybe not too high, which you will make your neck to flex a bit. So try to make it more ideal, which your neck doesn't flex, doesn't bend too much. Yeah, so this one is an important tips for the sleeping also.
Your opinion about nowadays with the pandemic going on, there are more and more people actually working from home, and a lot of people are online almost 8 to 9 hours a day, and the importance of having a workstation, a proper workstation. Would you like to advise the patients that in the new environment, right? They're not used to sitting down face to face on a device, multimedia device. So what would you recommend for their workstation?
Okay, so for example, if you are using a laptop while doing your work, so what I would advise is try to lift up the laptop close to your eye level, so that you are not looking at the laptop facing down. Yeah, not to bend your neck too much of that. And then another thing is the table and the chair that you use is not in a very low position, which is higher, which is better. And then another would be you have to take care of your own body posture also. So some people will, when they are using the computer, they try to shrug their shoulder. So you'll be using like this. So this one is a very bad posture for the upper back and lower back also. So it will increase more pressure in the upper back here. So they will always feel the neck and the shoulder here will be very stiff. So this one is a very important thing to take care about. And then another thing, what you can do is when you are sitting in the chair, make sure both of your feet touches the ground. Because this one, if it not touches the ground, it will increase more of the pressure of the back. So make sure both feet touches the ground where you can sit more comfortably.
Okay, what about gardening and maybe things like mopping and maybe washing dishes? How would you recommend them to do?
Okay, so for washing dishes, if you are quite tall and then when you are washing you are bending down, what I would recommend is this one happen usually people with a radiculopathy, for example, like pain radiate down to one leg. So you can have a small stool while you are washing dishes, and then one of your leg you can step on the stool, so that this one is not the pressure is not on your both leg, which is one only. So you can switch both sides together. So this one is a very good tips which helps to reduce the pressure of your back also.
Yeah.
And then another thing would be try not to bend down and wash dishes for too long. Maybe about 1 to 2 minutes. Then you have to come up back straight, and then or maybe you can hyperextend your back once, and then you come back again. So try to have more movement during the activities.
Yeah. So one of the things that patients usually say is back pain and the pain coming down to the buttock and the legs. So would you like to maybe describe to us a little bit of what would you recommend? How would you all deal with radiculopathy or pain coming down the legs?
Okay. So this one actually is a very different kind of approach compared to the pain that is localized at the back. Because this one, you have to make sure that is it the pain that comes from the nerve root of the back, or sometimes another case is which we call it piriformis syndrome, which is a muscle involving in the buttock. So what we will do is we will do a set of assessment and physical examination to rule out which one is the real problem, which one is the root cause of the problem. Yeah. If, for example, if it's a piriformis syndrome, which involves mostly in the muscle, so what we will do is we will try to release the pressure of the muscle because the muscle is too tight, which is, it will touches the nerve and become more sensitive to pain. And then another thing is for the stretching, we have a more specific kind of stretching which target the muscle.
Yeah. So okay, that's a lot of information over there for them to do. So Jason wanted to talk a little bit about his topic. Did Jason want to say anything or wanted to add anything?
No more.
Okay.
So, yeah, she's good.
So would you like to maybe do the take-home message or the summary of information you wanted to give?
Yeah. So for the highlight for the physiotherapy management, we will encourage people to move more, having active lifestyle, and then take care of your sleep quality and your stress level, and then always have the awareness of taking care of your posture and your back care habits. So always install the mindset that you might have a more severe problem if you don't take care of your back. Yeah. So that's what we always encourage people to do.
All right, that's so excellent. Thank you so much. A lot of information over there, this John and Jason. I'd like to thank you guys from Apple from joining us today on Instagram on home remedies, how to deal with back pain. Just for everyone's knowledge, we'll be doing another one about the food bank and how the pandemic is affected the organization food bank during the pandemic. And I'll be having Mr. Sunil, and he is kind of United Sikhs Malaysia, and he's talking a little bit about food bank and about their efforts how they're dealing with the pandemic. Again, I'd like to thank you, John and Jason, for joining me in this Instagram Live. And hopefully, our listeners get to benefit from the knowledge that we give them, and hope to live better and more pain-free life. Yeah. I'd like to thank you all and see you all next week. Yeah. Bye. Thank you, John.
Okay.
Thank you so
Thank you,
much,
Doctor.
Jason. Bye bye.
Thank you. Bye bye.